What is a disability? What do you personally believe a disability looks like? Chances are you visualize a wheelchair user. And while there is nothing wrong with this assumption, it isn't the best representation of the disabled community. As stated by Volume 8 of the current research in behavioral science, 70 to 80% of the 70 million people in the United States with a disability have an invisible disability, which is a disability unable to be seen by the naked eye. And out of those 70 million people, 1 to 3 million of those have postural orthostatic tachycardia syndrome, or POTS for short. And today I hope to teach you about what exactly POTS is, how you are diagnosed, and what changes most patients make to their lifestyle to make symptoms more manageable. But what is POTS? Well, POTS is a condition where upon standing, the heart rate of a person increases unnaturally. This is usually above 100 beats per minute. And why is this important? Well, when your heart rate increases so drastically under a short period of time, it causes many symptoms such as dizziness, fainting, shakiness, shortness of breath, and chest pain. And while many people don't know this, not every condition falls under one category. POTS is one of these conditions that has 3 categories. The first one is hypoadrenic, which is classified by the loss of nerve supply. It can be from an injury, sickness, or anything else that can cause you to damage your nerves. This damaging of nerves prevents your body, from being able to healthily regulate heart rate. And neuropathic is classified by an overactive sympathetic nervous system. But what is a sympathetic nervous system? Well, it is the part of your brain or body that processes autonomic functions, which are functions you don't actively think to do, like breathing, beating your heart, blood pressure, and all those other things. The third and final version is hypovolumenic, which is classified by low blood volume, which is exactly as it sounds. You don't have enough blood for your body. But what is the diagnosis process for postural orthostatic tachycardia syndrome? Well, in order to be diagnosed, you have to undergo a tilt table test, where you are strapped to a table in first a laying down position where they monitor your blood pressure and heart rate. And after a few minutes of laying down and getting your base markers, they tilt you to a 70-degree angle where they monitor your heart rate and blood pressure for a few minutes. This data will allow them to diagnose you with postural orthostatic tachycardia syndrome. Although this test exists and it's not that hard to do, the majority of patients, especially female, are misdiagnosed with anxiety because of the overlapping symptoms like shortness of breath, shakiness, and brain fog. And despite that, 80% of POTS patients are female. It takes double the time for them to get diagnosed as compared to their male counterparts. Sorry. But what do you have to do when you find out you have POTS? Well, doctors advise that those who are diagnosed with POTS up their water intake to 2 to 2.5 liters per day. This usually helps with blood volume or hypovolumenic patients, but can be helpful for all because dehydration worsens symptoms for all of POTS patients. It is also advised that you increase your salt intake from 3,000 to 10,000 milligrams per day. This is because salt helps retain water, and retaining water prevents you from getting dehydrated and helping with your blood volume. The third option, which is usually reserved for more drastic cases, is known as medication or beta blockers. These beta blockers block adrenaline, a hormone, from getting to the rest of your body. Adrenaline can increase your heart rate, and as a result, when you block this, it decreases your heart rate, so your heart rate won't be as high when you sit or stand. Let's go over what we just learned. Well, POTS is a condition where your heart rate increases unnaturally upon standing, and you are diagnosed through a tilt table test, although it is often misdiagnosed as anxiety. And many POTS patients have to modify their lifestyle to manage their symptoms, usually through water intake, salt intake, and medication. And I hope that this small, short speech has helped you understand that not everything that a person is going through is visible to the naked eye. While it might not be mental, it can also be physical. And some of these invisible disabilities are, of course, unable to be seen. So, when you see someone sitting on the floor or using a handicap space, but they don't have a visible disability, don't automatically think that, oh, they're just being lazy or they're stealing that space for an actual disabled person. They might actually be disabled themselves, and you just don't know it. Thank you.